Well, good afternoon, everyone, and I do appreciate people for coming out, and I was explaining to Will that some people will be tuning in their offices as well. My name's Toby Barrett, MPP for Haldeman, Norfolk. Over the summer, as with other MPPs, I've had meetings with a number of people, primarily concerned about Lyme disease. And over the course of the summer, I decided to put together legislation, a private member's bill, to deal, essentially, to deal with infectious diseases. I would like to mention that both MPP Jeff Urick is here and MPP Lisa Thompson are here in the audience. And I will ask Will to tell us his story in a few moments. Will Yelland, a constituent of mine from the town of Dunville. Will went camping August of 2010 and has been living through a bit of a hell ever since, and we'll hear about that in a few minutes. The proposed legislation that I've put together, it's brand new legislation. It's not amending any existing legislation, which again suggests to me an issue if there already isn't legislation to deal with infectious diseases specifically, and it's titled Provincial Framework and Action Plan Concerning Vector-Borne and Zoonotic Diseases Act 2014. It will be debated this coming Thursday. As the title suggests, I'm essentially calling for the Ontario government, the Ministry of Health, to establish a provincial framework, to establish an action plan with adjacent guidelines to follow to better enable us to prepare for emerging infectious diseases, whether it be Lyme, whether it be West Nile. There was quite a ruckus on West Nile 7 or 8 years ago. This would cover other emerging diseases like the Ebola virus, Marburg virus. We don't know what else could be coming. And we have seen, even going back to the SARS epidemic, that oftentimes in Ontario we are caught somewhat flat-footed. We're caught unprepared. The provincial framework, the action plan, focuses on a number of areas. Surveillance for one. Educational materials, not only for the experts and government institutions, but for the general public. And as I mentioned, a series of guidelines. Prevention is key. Prevention is cost-effective at minimum. Many of these diseases, there is no vaccine. There really is no effective treatment. Prevention is the only option. Identification and diagnosis. With respect to Lyme, so much confusion with respect to diagnosis and what diagnostic tools, which tests are most appropriate. I'm not making any judgment on that. I'm setting up a framework, as I mentioned. Treatment. We need to lay out treatment guidelines regardless of the particular disease. And again, so much confusion with respect to what treatment is appropriate and where do you get information about treatment, and lack of trust of some of the information that people have been receiving. Management, another very important factor, including emergency preparedness and the sharing of best practices. This is all mandated in this legislation. This legislation will mandate a more serious program of research with respect to all of these emerging diseases, depending on where the research is oriented. And the principle that I follow with all of my deliberations, all of the work I've done on this legislation is it has to be based on neutral, objective, scientific data. It has to be evidence-based, peer-reviewed. Another factor that is incorporated in this legislation, the requirement for collaboration among all concerned, This legislation, if it receives the votes on Thursday, I would ask it be referred to an all-party standing committee for public hearings. And I know there's also been a call to establish a select committee as well. And again, that we can go either way on that one. The legislation requires consultation, requires the ministry to also set up a website. So very simply, I have legislation here. It's designed to streamline the whole process, to better enable us to be prepared, and to help facilitate the efficient, effective allocation of scarce health resources. So I would like to stop here, and I would like to ask Will Yelland if you could. We've met. I've heard your story. If you could just give us a thumbnail sketch of what you've been going through, Will.
Okay, so my name is Will Yelland. I live in Glenville, Ontario. I went camping in 2010, and that was the start of, for me, what is a nightmare. Before this all started, I was 220 pounds and athletic. I did martial arts and played with my kids, and I was just a normal person. I wanted to get into a career in law enforcement. I've been doing some martial arts, and I've been told that I'd be good at it, and when I got sick, I went to my regular doctor, and he sent me to a specialist, and then did all these tests, and they just never looked for Lyme. And a year and a half went by, and things just got worse and worse, and I had to stop working. My wife now takes care of me. I don't know. I pretty much think I'm a burden to everyone right now. Then I got a blood test, and it gave me an indication, some evidence of where to look, and then that's when I had a second big shock, and that's the doctors don't know how to treat Lyme disease here. They do it in other parts of the world, but we're really far behind. And then I had to go through the treatment of Lyme, and treating it is no fun. It makes you feel like you're even worse than you were before, sort of thing. But I don't know. I've just had to keep my head down and keep moving forward, hoping that it's going to get better. That's all I can. That's all I can do is just hope it's going to get better. So I'm trying to get the word out. I go to a support group for this. I try to get the awareness about Lyme disease out there, and that's why I was really happy to hear about Toby's bill, because it may not be perfect, but it incorporates so many different vector-borne diseases that like, because right now there's nothing. We need something. We need some place to start, and this is a good start.
Okay. Yeah, thank you, Will. Just to wrap up, as Will indicated, this legislation, I've found over a number of years, no piece of legislation is perfect. I think it's a start, and I designed the legislation as I did the work initially on Lyme disease. I am from an area that, as I mentioned, there was quite a ruckus with respect to West Nile virus a number of years ago. I mean, I was driving around with a dead crow in the trunk of my car to get it tested on Monday. There have been a series of new and emerging zoonotic diseases, those diseases that have come, in many cases like SARS, have come from Asia. The host would be various species of monkey. So many of them, the host is a wild animal, hence the term zoonotic. Vector-Borne, as Will mentioned, Lyme disease is transmitted by the black-legged tick. West Nile is transmitted by mosquito. And it's been my experience, I'm not a physician. I have worked in the tropics for a number of years. I have picked up a number of minor tropical diseases. And when I come back to Canada, it's hard to find a physician who has studied tropical medicine. I've been fortunate, a local doctor was from Jamaica and understood this. So in many cases, I feel we're just not up to speed. We have government for a reason. It's really unfair for people like Will, for other people. I think of Shelby McNeil in the town of Caledonia, who was unable to come today to tell her story. She has an important doctor appointment today. But in many cases, these people are on their own. They've set up their own support groups. Oftentimes, they rely on the internet, for example. And I've also found in my discussions with people there is a lack of trust with respect to our healthcare system. Lyme disease alone is fraught with conflicting medical views, depending on which side of the border you're on. For example, there still doesn't seem to be consensus in the scientific community and the political and social dimension. So the disputes are out there. Social media is a valuable tool. We also know social media has been accused of communicating inaccurate medical information, pitches for what some people consider somewhat dubious and oftentimes expensive treatment. On the other side, we hear allegations of the shortcomings in diagnosis, the shortcomings in treatment of Lyme disease, for example, that are directed at Main Street medicine. We have government for a reason. There is no legislation to deal with this. This bill would fill that gap and, in my view, would get us on the way to perhaps have a more concerted effort, to perhaps have government and various entities come together for a more concerted, a more serious look at not only Lyme, West Nile, Ebola, Marburg virus. We don't know what would be coming next. We know what has come in the past, and it's just essentially an approach to try and fill a gap in what is normally a very good healthcare system in the province of Ontario.
Yeah, this is definitely a big crack in our system, and kind of like when you fall into it, it's impossible to get out. Because right now there's either you have to go through private doctors, or like the person who I thought would be here today, off to New York to see her American doctor, or you have to go through naturopaths or go out to BC to get treated in Canada, sort of thing. But it's we need a retooling, and we need to look at this, because right now like we're failing ourselves, because anyone can get it anywhere. Like, you just go to the park to walk your dog and you get bit by a tick. It's preventative. It's just a few weeks of doxycycline or an antibiotic, and then there's nothing. But we have no testing, so now it's like people go on for years, and then you don't know how long it's going to affect you and last you, and there's a lot more guessing, and it's a lot more expensive.
Well, we have these systems in place, and our goal is to put them to work. I know I could ask for any questions or comments? And hearing none, and I don't know whether our producer would allow questions from the audience. So I think we will wrap it up there. This legislation will be debated on Thursday, and it'll be in the hands of the MPPs in attendance what they wish to do with it.
Okay, thank you.
Thank you very much for coming out.
Thank you, Toby.
Okay, thanks.